Dr. Sapna Makhija, gastroenterologist with an interest in clinical nutrition and co-owner of GI Health Center in Burlington, Ontario, joining us on Canada Now.
Thank you so much for joining us here today, Dr. Makhija.
Thank you for having me.
So we're here today to talk about colon cancer. And I have to say that I don't think I know much about it myself. You know, there's a whole bunch of other different types of cancers that we learn about. So can you talk to us a little bit about, some of the things that we need to know about colon cancer?
Of course. First of all, colon cancer is very common. Mm-hmm. It's the third most common cancer. It is the second most common cancer-related death. So 1 in 13 men and 1 in 15 women will be diagnosed with it in their lifetime.
One of the things that I think people don't really spend much time thinking about, aside from being careful, to try not to get COVID-19, is that you can get it, you can recover from it, and have long-lasting issues, and this may be one of them.
Yes, definitely. I mean, I think it's really interesting to note that initially when COVID was being identified, it was primarily thought of a lung disease. So the screening symptoms were always fever, cough, shortness of breath, and then as time progressed, we realized that was actually involving, in a lot of patients, the predominant area of the gut with diarrhea, nausea, anorexia, or loss of appetite.
What are the top offenders for poor gut health?
So the biggest or the most obvious one is diet. So you develop your microbiome, that microbiota in your gut, by the time you're about 3 years old. Now, over time, that will change and get modified, whether you've taken antibiotics, the type of diet you eat, how many infections you've had in your life, particularly affecting the gut, or there's other inflammatory conditions that'll also affect the gut. But ultra-processed food or like excessive added sugar, things that are like boxed in the grocery stores, we already know that they're bad for you, but we also know that they decrease the microbiome diversity, meaning that they reduce the amount of good bacteria, increase the amount of bad bacteria that are present in your gut.
So am I right in thinking then that this is sort of like a stacking effect? There's poor diet, and then you add in stress, and then maybe you add in, other things, other external forces like alcohol or tobacco or drugs, and so it's sort of this compounding effect over time?
Definitely a part of a compounding effect. I mean, a small study has actually shown that even 2 hours of stress on the body can affect your microbiome. A lack of exercise can also affect your microbiome. So a small study suggested that even 30 minutes a day, 5 days a week, after 6 weeks, actually changes your microbiome to some degree. We don't really know as the exact effects of tobacco, but it's definitely a compounding effect with multiple different things. So what we know is the easiest to modify is diet.